Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
This one really blew my mind. Dr. Michael Nadorff. He is a psychologist at Mississippi State University, runs the Sleep, Suicide, and Aging Lab. I want to tell you how I got to him. I don't know about you, but I have been having vivid, stressful dreams during COVID, and I was, just so interested what is going on with me, and I'm hearing it from other people too, that they're having stressful dreams. And I just do this internet search, stressful dreams, and what does it mean? Do I wake up stressful? Some sort of very simple search, dreams and stress. And, I couldn't find many studies, but I found the work of Michael Nadorff and reached out to him and just had a super intriguing discussion about what bad dreams are, what nightmares are, and how they affect us, how our life affects dreams, how they affect memory and how they affect learning, and what very simple interventions we can do to improve the quality of our dream states. So with that, I hope you enjoy this. Dr. Michael Nadorff on dreams and stress. So, honored right now, I have a conversation with Dr. Michael Nadorff in Mississippi. And I want to just say welcome and happy Thanksgiving. We're a little bit after, but it's nice to have you, and I'm glad we got to connect.
Absolutely. Thanks for having me, and happy Thanksgiving to you as well.
You too. And I just want to tell everybody how I stumbled upon Dr. Michael Nadorff in Mississippi at Mississippi State University. So here's my story. I, like everybody else, have been, at the grips of COVID. And back in March, when, everything was unfolding with COVID, there was so much uncertainty. My wife wasn't working to the capacity that she usually does. I had no idea what was going to happen. I'm a father, I'm a provider. My wife is a provider, so we're in this period of uncertainty. And what I'm noticing is, oh my gosh, my dreams are so vivid. And they're not only vivid, they're super stressful. And I'm waking up stressed out, and I'm having recall of these very stressful dreams. And they feel like nightmares in the sense that they're stressful, but I'm waking up stressed out. And I speak to my colleague, one of my students, and I say, I don't get it. I don't get what's going on. Why am I having such vivid dreams? And is there who's talking about stress and dreams? And I'm thinking about it. I'm thinking about my training. I'm a psychologist, and I'm thinking, I know that psychoanalysts really were into dream interpretation, but I'm not really into the interpretation. I'm into why am I feeling such stress? And then I speak to some of my CBT for insomnia colleagues, and they're like, yeah, I don't really know who's talking about the quality of dream state. I know that we talk about sleep quality, but actual dreams, I don't know. So I'm like, I do this very sophisticated thing. I wrote stress and dreams in a Google search. And the only thing that comes up is, for me at least, is Dr. Michael Nadorff and colleagues write this article about generalized anxiety and dreams, and, how if you treat anxiety, this is back in 2014, maybe you'll have you'll be able to influence dreams or reduce anxiety. And I'm like, oh, why don't I reach out to this Dr. Michael Nadorff? And here I am. And months later, we're getting together, and that is what I want to talk about. So, with that
Absolutely.
introduction, with that long introduction, welcome. And why don't you tell us a little bit about what it is you do and what your interests are?
Absolutely. So I do a lot of behavioral sleep medicine work. I also do suicide prevention work, and have been interested in dreams and nightmares for quite a while, just from seeing first the association with suicide, and then later in my research looking at the association with a whole host of other psychopathology and other mental health issues. And it's such an interesting area because it's a universal experience that we have, but also, extremely impactful and treatable. People don't realize that you can treat bad dreams. And there's so few providers that do it. And so just I've just been fascinated with this area, and I've been trying to figure out ways to get our interventions out to more of those who need it, because we have good interventions, but it's hard to find providers.
So let me take a step back. When I speak about
Yeah,
me, I'm also speaking about, shared experience. I'm seeing it in my patient population. I'm seeing it in my colleagues. I'm seeing a lot of people having what you're referring to as bad dreams.
yeah,
And and so maybe it would be helpful for me, and I'm going to, just expose that I don't know much about the distinction between a bad dream and a nightmare, and what
sure.
you mean when you say there's what we can do about bad dreams. Maybe give us a little education about dreams in general.
Absolutely. So, first, there aren't many people that differentiate between bad dreams and nightmares. It's a small, nerdy group of us. But essentially, the difference is both are negative dreams, so both have negative, themes in them, or stressful dreams. The only real difference is that a nightmare leads to a startled awakening. So, a nightmare is that awakening where your heart's racing, you're jolted awake, you're sweating, that sort of experience. A bad dream is where you wake up and you realize um, that it was a really crummy dream, but you didn't have that startled response. We know for both of them you wake up because one of the cool things, there's a lot of cool stuff with memory and sleep, and that's a different topic, but there's so much cool stuff there. But one of the cool things with memory is if you don't wake up during a dream, you don't remember having it. And that's why you all have people that say that they don't have dreams. It's not that they don't. We all have dreams every night. It's that they don't wake up during their dreams. And so that's why the only real difference between a bad dream and a nightmare is just whether that awakening that happens is startled or not.
So let me just
Eh,
backtrack. So you can have a bad dream, and it's not a nightmare if you can remember a bad dream, and it won't qualify as a nightmare because it didn't wake you up as in a startled way. If you wake up in a
Correct.
startled way, right, it's always going to, the assumption is it's going to be the same content, but it's just more startling. In other words, negative,
Mhm.
you know, perception of the experiencer of the dream, right? What may
Mhm.
be a bad dream for one person may be a good dream for another, right? It's more the
Yep.
interpretation of my dream experience as quote unquote bad, right? But
Correct.
really it's up to my interpretation and how I wake up. However, there's tons of dreaming going on that I may or may not that I won't remember, right? And that content could be negative or positive.
Absolutely. And there's been a lot more dreaming during COVID. So, kind of jumping to something you alluded to, so many of us experience changes. And what's really interesting is I got the opportunity to be part of this international consortium of researchers where I think we're in 18 different countries, 4 different continents. We all did a study right during lockdown looking at changes with sleep and dreaming. And one of the things that we found is pretty much everyone did have an increase in dreams and an increase in nightmares. And a big reason why is because everyone's sleep changed with the lockdown. And it's worth mentioning because I know in a lot of places, I know in LA, there's the movement towards going back into lockdown again. What happens is a lot of our REM sleep, which is where we have our dreams, happens later in the night. So it happens in those morning hours. And what all of us seem to be doing is when we go into lockdown, we're going to bed later and we're waking up later. And so we're actually shifting our sleep in a way that makes it so we're going to have more REM sleep and thus have more dreams naturally.
Mm.
So when you combine that with all the stressors and all the ruminations that are happening right now with COVID, you can quickly see why it is that people are having more dreams, more vivid dreams, and also having really weird dreams.
So the implication that I'm hearing is REM sleep equals more is it's where dreams happen. So increased REM sleep, increased dreams, and also
Yep,
increased stress, increased stressful dream. Is that
absolutely.
accurate? So what goes
Absolutely.
on in my life could impact the quality of my dreams.
Exactly. And to fully get that, part of it, this is where it goes actually back to memory. One of the big things that happens during REM sleep is that's when our memory is consolidated. And there's this old hypothesis that I love from the 70s called activation synthesis. And so it's a theory of why we dream, specifically with memories. And the thought is that um, when your brain is consolidating these memories, it's doing two things. It's both storing the new memories into long-term memory, and it's also going after the old memories that you haven't thought about in a long time and refreshing those. And that's how you end up with these things that you'll have it where it's something that happened yesterday combined with something that happened 20 years ago, and your brain throws it together in this odd dream. That's what's going on. Is it's this activation that's happening, both old and new, and the brain is trying to bring it together and make sense of it in a story. And so when you think of COVID, you know, right now, so much of our lives are around COVID and around the changes and stress related to it, worries related to it. And so all those memories are going to get encoded and consolidated the same way. So that's why that keeps popping up into our dreams as well.
So help people understand this. This is really important to me. There's an adaptive function to dreaming. Forget about,
Hmm.
let's take Freud out of the story, right? And trying to understand the depths and the meaning and the symbolism, right? There's also an adaptive quality regarding memory and memory storage and consolidation and making sense of things. So,
Absolutely.
and that is mostly happening during this REM stage of sleep. All sleep is important, but for memory in particular, the theory that you're referring to is dreams are getting not dreams help us to make sense of our world and learn lessons and make sense of things in that space of REM, and in doing so, we're going to, in stressful times, it's going to be even more active because we have to make sense of this new information and connect it to the old information. Is that what you're saying?
Absolutely. So you're making those connections, and also just the themes that are most vivid and most memorable during the day are the themes that are going to also naturally pop out. And if you're really worried about something, or if you're ruminating on something, if you're worried about losing your job, for instance, that's going to come up in your dreams because it's something that was such a salient part of your day.
That's so interesting that you're also talking about this idea of it's done in narrative form. What do you make of
Yeah.
that? Like it's done in story form instead of some other like coding, but the coding is actually a story, right?
Yeah. And in a way, it made sense to me in that, you know, everything in human history is a story. When you think of it, just the way we process information, the way we've processed, our history forever has always been story. And so what that kind of makes sense that, so much of our, both our memory processing and also emotional processing happens in that narrative format.
It's just part of the human condition. You're saying is this is history, and this is the way we do information is we make story of things, and this is logical that even in a dream state we're going to use story.
That's my view. I'm also curious your view on it.
So yeah, no, I think it makes total sense to me, and I'm sort of tripping out on it for the first time that that this is a process of learning, and I need to what seems random to me, and this is what I'm extrapolating from this is what's seemingly random in a dream. Like, why am I thinking about my third grade teacher when I'm getting thinking I'm going to lose my job, right?
Hmm.
Right, there must be some sort of connection, and it's like kind of props to Freud and colleagues, right, at the
Yeah.
time, is they knew that there's something in the story that's making sense of life and what's going on. So it has to be that the connections, right, the theory would say that those connections are making sense of things for a reason.
Yeah, absolutely.
So that's really cool. My colleague here has a question that I think is a good question, which is, does negative content in dreams, which we actually don't remember, so to qualify as a bad, in this state of bad dreams, it's the dreams that we remember you're talking about. Do those negative dreams we don't remember affect us in terms of our waking emotional states? Or do we actually need to
Mhm.
remember it to affect us?
You know, and the answer is we don't know, but I think there are reasons to think that they might. And yeah, a couple things, and these are just little factoids that I mentioned, you know, with very little evidence behind them, but just they're kind of hypotheses that have been in my head for a while. Yeah, there's an association between REM sleep and depression that we don't fully understand. And a couple ways it's illustrated is first of all, actually, if you suppress REM sleep, the in the short term, like over a course of a day or two, you actually have a very strong antidepressant effect, which is interesting. And when you actually look at most of the SSRIs and the antidepressants we use, they almost all suppress REM sleep. And there really hasn't been research looking at how that may play into the mechanism and whether or not it plays into the mechanism of how those drugs work. That's something I've just pondered for a long time. And so, certainly there's a lot of good that happens in REM. There's emotional processing there. There's the memory we talked about. But I do think it's possible that there are some negative sides to REM, and perhaps that's one of them. Maybe it's that those negative dreams that we don't remember are having an impact, and when we suppress that, that's actually part of the reason why we see those treatment effects.
That is that is crazy. That's nuts what you just said. It just got me thinking that any mental health condition, I'm wondering, that has the quality of you know recycling themes, like I'm going
Yep.
to get in trouble,
Yep.
trouble's coming, or depression, I'm the worst, I suck, life is worthless, right? If that's my predominant content, or I'm in danger, right? And I'm extrapolating from what you're saying is, and wondering if the space of anxiety and post-traumatic stress also
Hmm.
have a quality of, if you reduce REM sleep, that there could be a capacity for improvement. If my content is so intensely um, distressing, and I keep recycling it even in a dream state, perhaps it makes it even worse.
Yeah, and I think that makes sense. I mean, one of the things that we'll do for PTSD is we'll give an SSRI. Why? Like theoretically, I think the cleanest answer for why is possibly that REM reduction, because otherwise, what mechanism does it have that's helping with PTSD? Do we think that there's a serotonin imbalance there? It's like
Well,
I
perhaps it's
don't
an
know.
anxiety issue, and but even with
True.
anxiety, right? This concept of SSRI in general, which started as antidepressant, right? Maybe
Yep.
it's it helps bulimia, it can help with anxiety, it can help with depression, right? It can help with so many things. But what you're saying is, in terms of a learning mechanism that happens in REM sleep, if I decrease REM sleep and I don't have to recycle content, right? If I don't have to recycle
Hmm.
content in the same way and actually learn and reinforce information, then maybe I'm going to have more of a shot of at treatment. So, just out of curiosity, let's just jump into it a little bit. We're
Yeah.
talking about the impact of dream states on depression, right? Sleep
Hmm.
quality, weight, if the content of my life is stressful, right? My dream content is impacted. If the content of my life is depressing, my dream content is impacted. You mentioned it
Correct.
earlier. What diagnoses do you study that you definitely see there's an influence in terms of dreams?
Yeah. So this will also blow your mind because there's so many associations that people don't realize. So with dreams, everyone thinks PTSD, and yes, of course, there's an association there. One thing that's interesting is this: you actually look specifically at nightmares. If you have nightmares before a trauma, you are more likely to develop PTSD. So it's actually a risk factor. It's not just a symptom; it's also a risk factor. And you also see pretty strong associations between nightmares and borderline personality disorder. Um, you'll see it with, oh shoot, just right on my head. One that surprises people, you actually see it with schizophrenia. Nightmares are common right before a relapse of schizophrenia. Um, you'll also see it with some dissociative disorders. But really, when I think of like what's the link overall, the primary link with mental health, with nightmares and with disturbed dreams is problems with emotion regulation. And as we delve kind of more into like why are nightmares associated with suicide or these other disorders, I really think that plays a big piece of it. And perhaps that's also why you see the association that I mentioned with PTSD is maybe it's individuals that have trouble with emotion regulation going in, and because of that, they have trouble, dealing with the aftermath of a trauma.
Wow. Yeah, it just makes me think that the predisposition of having a lot of distress and a lot of rumination and a lot of dysregulation, right?
Hmm.
It's just a place to reinforce the content, right? So if my
Absolutely.
content is, if I'm a ruminator, or if I'm a worrier, or if I'm somebody who's in distress and about relationships, it's just a place where I go to reinforce what I'm focusing on. So focus on
Absolutely.
that. It's going to get, even when I don't remember my dreams, it was the original statement, right? The original question. I'm still going to be reinforcing that. Take away REM sleep. Perhaps I have more of a shot of not doing it. So let's get into
Yeah.
intervention for a little bit. One
Yes.
of the
Yes.
questions that my colleague asked also is that, what do you think about nightmare medications?
Great question. There's actually a paper that just recently came out on this, a consensus paper, where for a long time we've been using prazosin, which is a blood pressure medication. Um, but actually, there's a recent study that was done, very large study in PTSD nightmares, that showed no effect with it. And it just has not been a promising area of research. So, because of that, they actually downgraded prazosin. Um, Also, on the flip side, and this is one where I know just enough about mechanism to be dangerous, I need to learn more, but there's getting to be some promising evidence um, for marijuana with nightmares. But again, that's very, very early days, and a lot of it hasn't been published.
So
But I'm just
let's
starting to hear those presentations.
So outside of the drug space, right? Because that's
Yeah,
outside of the drug space. You said earlier, generalists like me, or I work in addiction a lot, right? I don't even
yeah,
know. I don't even, they're so blotto. I don't know if they remember any dreams, right? Right.
yeah.
So I don't know. So my question to you is, I mean, that really affects REM sleep. So,
Mhm.
and actually it's interesting. I find that with addicts, they're learning new information and process learning from experience is so hard because they're so shut down from drugs.
Yeah.
If I take this discussion and I say, what could we do as clinicians? What are interventions for people who are either having bad dreams or nightmares, negative
Mhm.
content dreams? What do we know now that could be helpful?
So the leading treatment out there is imagery rehearsal therapy, and there's been a great literature on it. It's been published in JAMA. So there's a great literature on this, and I mentioned that, and it is, a consensus recommendation from, a panel that was put together by Journal of Clinical, or not, it's published in Journal of Clinical Sleep Medicine. It was put together by American Academy of Sleep Medicine. And I mention all this because this is an intervention that is so simple
Mhm.
that you won't believe me that it works if I don't tell you there's a lot of research behind it. So, what we do, in short, is we have, for an individual that has recurrent dreams, and we'll talk about what to do with non recurrent in a second, but for recurrent dreams, you have the person take that dream, change it any way they want to. They add, you can change who's in it, change where it's happening, add superpowers because it's a dream. Anything you can do in a dream, you can do with this. So change it any way you want to, but then you rewrite it in a way that it'd be a dream that you'd want to have. So not one that's less negative. You want it to be like one you'd actually desire having. So once you've done that, then you go ahead and you practice that using visual imagery for about, 5 to 10 minutes a time, 2 times a day. That's all you have to do.
So you write it out,
And
and then the visual
mhm,
imagery is you read it and you play it out in your head what it would look like.
it's that you're visualizing, you're trying to make it as vivid as possible because, in general, we know that anything that happens in our life, the more vivid it is, the more likely it is to pop into our dreams. So, with that, actually, the more vivid we can practice this, the more likely we're going to actually dream that during the night instead of the other stuff.
So I'm a person who I keep having themes, the same theme dream over and over again. I go to
Yeah.
I go to you, right? I
Mhm.
end up you have me write it out, get really really specific. I write it out and you say I want you to practice that over and over again. I really think about it, really get specific, really imagine it in your head. Imagine it playing out. Do that for
Yeah.
10 minutes a day and voila, that's the treatment.
Yeah. Yeah. For most people, you'll have it where you'll start having the dream. Some people just stop having the nightmare that was causing it, but it works for the vast majority of people.
And
And it's that simple.
that simple, right? And what about for, you said we'll get into it, non-recurring themes? Just I have
Yeah.
bad dreams.
So you can do the same thing ultimately if there's truly nothing that recurs. But often what I find is if you track the dreams that happen, there's usually something in common um, that links it all together. So I remember one client who had a PhD, and I mentioned that because I don't think that was unrelated. I
Mhm.
think so many of us that go for advanced degrees, get this mindset of she had this recurrent dream is always different. It's always I was responsible for something, I forgot, and something very bad happened. And so what we did is, but they were always different. Sometimes it's I forgot to feed the cat, other times I forgot to turn this in. So we actually rescripted a new dream and we had it where I was responsible for something. I checked and I'd already done it. That was all we changed. And we just actually had her do visual imagery of checking and realizing she had already done it. She had already turned in the assignment. She had already, fed the cat. And that's all we had to do for her. So it was one of those where it wasn't, just strictly a recurrent dream, but it was a recurrent theme that we went after.
So let's say I'm a person who thinks I'm always going to get in trouble. Trouble's coming, trouble's coming, trouble's coming, right?
Yes.
And I don't, it comes in various forms in dreams or stressful. That's just, I'm either getting my ass kicked or I forgot something at work or some trouble's coming. I'm an anxious person. And
Yeah.
I go to you and you just have me script dreams that are like, hey, there's no trouble coming your way. It's relaxed. And you're like smooth sailing and you vivid smooth sailing experiences that may
Mhm.
actually reduce some of the dreams at a minimum that are more stressful.
Yeah. And also, yeah. as crazy as this sounds, this is also where I'll work in the superpowers. Because if trouble's coming, but you don't know what's coming, one of my favorites is have a force shield around you. Have it where people can't get to you. Have that or be able to fly. Like as crazy as it is, these things you can actually work in. And then when there are things that are unexpected, the more you've worked that in during the day with your practice, the more you're able to use that at night to actually get out of those situations and escape when that trouble comes.
Are you talking about in the dream or in real life?
In the dream.
Okay. So in the dream, because this is my next question is, if I
Yeah.
can do it and this is sort of goes with your theory, I'm wondering if I can do it in a dream state and influence the dream where I'm trying to, where your theory that I'm extrapolating is that whatever I'm focusing on in real life gets focused on more in a dream state and reinforced and learned and consolidated. If I can overcome it in a dream, perhaps it will impact my day-to-day functioning too.
For sure. And, one of the reasons I love these interventions, one of the reasons you can tell I'm so passionate about this topic is because when you look at this literature, these interventions are so powerful. So the treatment I told you about is usually done anywhere between 1 and 3 sessions. It's super brief. And what I love about it is not only do you see a large effect size improvement with nightmares, but you see that with PTSD as well. And you see a moderate effect size improvement for depression and anxiety. Like it has really broad effects, I think, for exactly the reason you mentioned.
So you speaking to the sort of general therapist throughout the world, right?
Yeah.
I think you would say this, do some of this, right? It may
Yeah.
not be it's not the only game in town, but this will have impact on your treatment. No, pretty much in almost anything you're treating.
Absolutely. And, there are also tools that there's not enough research on yet, but there are tools that you can use to help you. But for sure, build it into your practice. So there's a app called Dream EZ. So Dream and then the letter E, the letter Z. And it was actually put together by DOD and the VA. So it's a free app. It's out there. So that's the perk. And there's actually made to be done in conjunction with the therapist, but it doesn't have to be. But it's based on the same treatment we just talked about, imagery rehearsal therapy. And there's been basically no research on it because the government, as it will, paid for the development. And as soon as it came time for validation, they pulled the funding.
Mm.
But we actually did a dissertation project on it where we identified people that had at least weekly nightmares, and just students at our university. And we randomly assigned them to 2 groups. Either is a group that's just a wait list control, so just like we'll follow up with you in a month, or a group where all we did is we told them, this app exists, go download it and use it. That's all we did. So it's the most minimal intervention we could. We literally just told them it existed. With that, we got a significant decrease in nightmares in that treatment group compared to the waitlist control. And we almost got an effect on PTSD. It was P equals 0.06. And we weren't even trying, we didn't even have a sample that was really high in PTSD. But it was, especially with these youth, they're up on it enough. They're able to go download the app, figure it out on their own. So with that, it's really not hard for a therapist to, have it, give it to a client, work with them on it, and to have, kind of have that, uh, have that help and assistance if it isn't something that is, a core part of your practice.
So it's that easy, right? And it's that accessible, and it has impact. Is this and in your opinion, of all the different interventions out there, this is the dream rehearsal therapy, or even using this app in a similar way, this is go-to intervention, super, super easy to access intervention.
Yes. And no, though I will say, keep in mind, I'm totally biased. Like I have drinking in the Kool-Aid on this, but
I
and
love your nerdiness, by the way. It's
oh, thank you.
your nerd investment in dreams. And because you're not at all talking about the symbolism of what different things mean in dreams. All you're saying is,
Correct.
hey, you as an individual, do whatever you want in this rehearsal to make it a good dream vividly,
Yep.
and you're going to be fine. I don't need to trip out on what a banana means in a dream.
Correct.
Right? And why you're dreaming about your second grade teacher or what the sexual content in is. Do whatever it is. If it's stressful and bad or a nightmare, you are saying, if you do this, you will feel better.
Yeah. Yeah. And there's, I think there have now been 20 different RCTs on this treatment, and it's effective. And you know, one there's one study, and I'll mention this just for clinicians that you listen to this. There was one study that did not show an effect with it, but I give the research group a lot of credit. They actually came back with the second study trying to explain the first one and why they didn't see an effect. And what it seems to be is, for whatever reason, if you have poor verbal memory, you don't really benefit from this intervention.
Oh,
So I mentioned that just as far as trying to pick who it's best for. So most people will do great with it. If you have someone that struggles with that, just keep in mind that that may be part of why you may not see a treatment effect.
interesting. Well, there's a couple more things I want to touch on. So in the realm of you also work in the university with people with substance issues. I know that
Yeah.
that's an area of interest. Do you find that the substance users, the people who meet criteria for substance use disorders, how does it affect dream states or not?
Yeah, it does. And, you know, I'll say actually, a little side note, but one of the things that I do in my work that gives me that's most fulfilling to me is working with the students that we have in our collegiate recovery community. So more and more universities are getting these where it's communities of students that are all in recovery in a program together where they're helping each other stay sober. And they're amazing programs. They end up with better graduation rates than the general student population, better GPAs. They're amazing students. And I've been honored getting to work with them for several years. And every year they always have me back and we talk about dreams. And what we found is that they do experience a lot of really weird both dreams and also sleep experiences. Um, dating back to their use. And a lot of times there are a lot of questions on why that is and what's normal and what isn't, and what may be because of use, what isn't. And but almost all of them report having very odd dream experiences, at least dating back to that time. And some have had to trail off as they've gone sober, others have not. But it
Are
does
you
seem to
saying
be something
dreams
that's
during active use or dreams in recovery?
both. So most of them in recovery will have had their odd dreams trail off, but there are still some that had it where it started with active use and it still continues.
You want to hear a really weird dream I had once? Like a really
Sure.
weird. So this is my story, and people who listen know it. I used to be really heavy,
Mhm.
really, really heavy, and you would never know by looking at me. It's one of the gifts of my life, and I had a dream that I was driving riding a bike in a desert, like in a windy desert area. It was a windy road, and as I would make the turns on my bike, it was either I was riding my bike. It was either a desert, and as I turn, it would turn into a cookie, like a frost cookie, and then I turn and it'd be a
Huh.
desert again. It was so
Yeah.
weird, and it was after I had lost the weight. And I'll never forget
Mm.
that really cool dream. And obviously, it was important. It was a point of tension in my life. Do I move?
Yeah.
Am I moving towards the cookie or am I moving towards health? Who knows? But maybe that's kind of the weird thing that you would see in a substance dream.
Yeah. Yeah. I think very possibly. And because also, I we do know that there is emotional processing that happens during our dreams. So there is processing and figuring, and that's why people sleep on it. So it makes total sense that that also comes out during your dreams.
So interesting. Next question. Suicide, right? And dreams, very, very important to you, right? So are you finding in the dream rehearsal therapy that the people whose content during REM sleep is so depressing and and can activate suicidal ideation, with the dream rehearsal therapy, is it creating a reduction in suicidal ideation?
We have seen that. So it's still very early days with that. But what we actually did a study with Menninger Clinic, and with that, we had so the limitation is it wasn't randomized. What we end up doing, because people at Menninger Clinic pay like $2,000 a day to be there. So what we did is we compared the people that said yes to receiving the treatment to those that turned us down, added on nightmare treatment in addition to treatment as usual that they were receiving. And what we actually saw is that those that um, did incorporate this treatment, image rehearsal therapy, into their treatment at Menninger ended up having better outcomes. They had lower suicidal ideation at termination, and they also improved a little more quickly.
Wow.
So we do have some evidence. It's still very early days on it.
Okay.
Um,
I
but
I
yeah,
I just think that's amazing. So that not only is their ideation going down, but their quality, their symptom reduction in general. So again, to your theory of REM sleep reinforcing depression. Fine, and with a person like you who comes on, it's just like we can fire questions at you all day. So I'm going to ask the last question. Ready? Hypogogic
awesome.
nightmare bad dreams, right? These
Yes,
hallucination like things. Maybe explain what that is and what's your take on it.
yes. Great question, because it's something that people will experience. And also sleep paralysis. They're kind of two in the same coin.
So what are they?
So so all that is um, we can have it where the brain is waking up, or where we wake up basically before our brain fully wakes up. So what the hallucinations, you can have it either before or after you fall asleep. So that's hypnopompic, hypnagogic. And what you see with those hallucinations is you're literally seeing your dream, but with your eyes. Like, so you're seeing what's happening in the world around you, plus your dream kind of laid on top of it. And the other thing that you can have that is common is sleep paralysis, which is it's natural that your body paralyzes itself during REM sleep, so you don't act out your dreams and hurt yourself.
Mm-hmm.
Now you can have it where you wake up, but your brain hasn't flipped that switch. So a lot of people, it's very common, will have had it where they wake up and for a couple minutes they can't move, and it scares the bejesus out of people.
Does dream
And
rehearsal therapy touch this, or that's separate?
it's going to be separate from that, because both of these are actually closer to narcolepsy. So it's REM sleep intruding on wake. And because of that, for both of them, if it happens rarely, it's viewed as perfectly normal. Like once in a blue moon, happens to everybody. If it happens frequently, it's actually one of the signs that we say you need to go get a sleep study and get tested for narcolepsy, because those are signs that we see, because all narcolepsy is REM sleep intruding on wake. And that's what both of those are, is it's REM sleep intruding on wake.
I got to do one more. This is the final one.
Yeah.
Fun question. Does
Yeah.
food before dreams affect dream state? So if I eat a little something before I go to sleep,
Yeah.
could it be an intervention, or is that like an old wives' tale?
Good question. I've never seen anything to say that it changes content, though it certainly could. I just don't know that it's been done. Now, what it will probably do is it will make it more likely that you'll wake up during the night. And because of that, it'll make it so you're more likely to remember the dreams that you do have.
Ah,
So that could be the link.
got it. Well, can I tell you something? I can do this literally. I can nerd out on this too, and I can do it for hours. And I'm so uh, grateful that we got to speak to you. And the
Absolutely.
take home point really, really is yes, life affects dreaming. Yes, REM sleep affects dreaming. Stress is here for those of us feeling, being more aware of our dreams. There's a reason. And if you're a therapist and you want to help people who are struggling and really reporting dreams, there's a really, really, really simple and effective intervention that helps people.
Mhm.
And I'm so grateful. I just want to ask you if people ever wanted to read your articles or and just sort of access what you're doing and what you're studying, where would you direct them?
Yeah. So all of our papers are posted on suicidelab.com. Or if you go to Nadorff.com, it sends you to the same place. The other thing I'll say, which I think is important, it's an offer I always make. I believe very strongly in these interventions. I think they have tremendous potential. I get that they're not out there enough. So if if you're a therapist and you want to give this a try, shoot me an email. I'll shoot you resources. I'll consult free of charge. I believe that strongly that this needs to get out there. And likewise, if you are a client, yeah, if you are going to a therapist and you think you need this intervention, I will also work with your therapist if the therapist agrees and contacts me. So I want to get this out there because I think it has truly the ability to change lives.
Wow. What's the best email to contact you?
Best email is going to probably be let me give actually my one of my MSU emails, M Nadorff, so M and then N as in Nancy, so M as in Michael, N as in Nancy, ADORFF, so F as in Frank, F as in Frank, at psychology.msstate.edu.
Wonderful. Well, this was a great conversation. I can think of so many topics to branch off on. So I hope we can be in contact. And I
Oh, absolutely.
enjoyed this. And thank you again.
I appreciate the service you're doing. Thank you so much.
All right. Bye, Michael.
Bye.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.